Facial nerves. Branchiomotor fibers control facial expressions. Muscles of facial expressions are derived from second branchial arch. Branchiomotor fibers have cell bodies in the lower part of pons. They make a nucleus called facial nerve proper nucleus or bronchomotor nucleus of the facial nerve. Fibers start from the seventh nucleus and go back of the sixth nucleus and turn. Because of this turn, they make a little elevation in the fourth ventricle called facium colliculus. Eighth cranial nerve, vestibulocochlear, is immediately after 7. After turning forward, they exit at pontomedullary junction. Seventh and eighth nerves are a little bit lateral toward the cerebellum, so we also call this place pontocerebellum junction. After exiting, these fibers will make facial nerve proper. Superior salivatory nucleus is right below the seventh nucleus. It is parasympathetic nucleus, has fibers in the facial nerve, make us salivate and lacrimate. Sublingual and submandibular parts are the responsibility of superior salivatory nucleus. These fibers are preganglionic and going to the seventh nerve. Below this there is inferior salivatory nerve, gives fiber to the ninth nerve, glossopharyngeal. All of these fibers were motor, and now let's see the sensory nerves. From anterior to third tongue, the taste sensations come. Touch, pain and temperature of anterior two-thirds of the tongue is a part of trigeminal. Posterior one-third of the tongue taste sensation goes with ninth nerve called glossopharyngeal. Area around epiglottis, taste sensation goes with 10th nerve. Taste sensation come back to tractus solitarius below the superior salivatory nucleus. Gastatory fibers or taste fibers from the 7th, 9th and 10th nerves end up in the tractus solitarius. Trigeminal has mesencephalic nucleus, pontine nucleus and the long spinal nucleus. All of these nuclei take touch, pain and temperature sensations from the face. Touch, pain and temperature from the face come and join the external ear for somatic efferent and end up in trigeminal's spinal nucleus. When all of these fibers exit, they make two bundles. One part has bronchomotor fiber and the other part has parasympathetic fiber, taste and pain temperature fibers. The bundle with three different types of fibers is called nervus intermedius. From the face, there is anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Beneath inferior cranial fossa, there is orbit, maxilla and tongue. Orbit and maxilla go back and make pterygopalatine fossa. Now from the external ear, there is external auditory meatus, then tympanic membrane which is the lateral wall of the middle ear, then interior wall and then the roof of the middle ear. Through internal auditory meatus, facial nerve will enter into anterosuperior corner of the medial wall of the middle ear. Eighth nerve, vestibulocochlear nerve, is also going with the facial nerve into the internal auditory meatus. Seventh nerve or facial nerve pass through geniculate ganglion and enter in the middle ear and move back in bony canal. The canal will move downward from the posterior wall, open in a stylomastoid foramen where one side is mastoid process and the other side is styloid process. Bony canal branch out to stapes through stapedius muscle. After exiting through stylomastoid foramen, facial nerve branch out. One branch go back of the ear and up called posterior auricular. Another branch of facial nerve goes to muscle stylohyoideus and posterior belly of digastric muscle. Another branch of facial nerve jumps into carotid gland and divides into 5 branches. Temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, cervical branch goes down in the neck. Parasympathetic fibers have 4 ganglions: ciliary ganglion, pterygopalatine ganglion, submandibular ganglion, otic ganglion. Lacrimation and salivation fibers enter in the internal auditory meatus, reach geniculate ganglion and separate. Lacrimatory fiber goes up, become greater posterior nerve, reach middle cranial fossa and enter in the foramen lacerum. There is internal carotid artery already present in here, and its sympathetic fibers called deep petrosal nerve will join them into pterygoid canal and enter into pterygopalatine ganglion in the pterygopalatine fossa. Combine both nerves in the canal are called combined pterygoid nerve or Vidian nerve. We have trigeminal ganglion in the middle cranial fossa. This ganglion has 3 parts: ophthalmic division, maxillary division, mandibular division. Through superior orbital fissure, ophthalmic division fibers enter and divide into nasociliary branch, frontal branch and lacrimal branch. This lacrimal branch ends up in the lacrimal gland. There is a foramen rotundum from where maxillary division is coming down from trigeminal ganglion. Parasympathetic fiber join maxillary nerve, which gives zygomatic branch and reach to lacrimal gland. From pterygopalatine gland, fiber do also go down to nasal gland, paranasal sinus gland and palatine gland. From foramen oval, mandibular division from trigeminal ganglion come down, divide into anterior branch, posterior branch and lingual nerve, which goes to the anterior 2/3 of the tongue to collect touch, pain and temperature sensation and not the taste sensation. Salivatory fibers, after entering facial canal, they move backward and then downward, and from posterior canaliculus they jump into the middle ear, and through pterygotympanic fissure they come out and join lingual nerve in the inner temporal fossa and then join the submandibular ganglion. From here, postganglionic fiber goes to sublingual gland and submandibular gland for salivation. From the anterior 2/3 of the tongue, taste fiber come with lingual nerve. They leave lingual nerve, enter in the middle ear, and then the bony canal come out and join tectus solitarius. Geniculate ganglion has cell bodies for taste and sensory fibers for external ear. Spinal nucleus of trigeminal system has touch, pain and temperature fibers, and these cells are also present in geniculate ganglion. They move with facial canal backward and downward in the middle ear, exit down from stylomastoid foramen, and go to the posterior auricular branch and give sensation to posterior part of the external ear. Chorda tympani is the nerve jumping in the middle ear, and we can see its shadow from the external ear. Now postganglionic fiber will start.